Hello, everyone. I'm Rose Gerber, the Director of Patient Advocacy and Education for the Community Oncology Alliance. As you can see from our agenda, I always start off each advocacy chat with sharing a very high-level advocacy update for you. So last week, we were on Capitol Hill for the first time as a very large group. Of course, during the COVID era, COA leadership did have a presence on the Hill, but this was the first time since COVID that we were back on the Hill as a large group. So it was an incredibly exciting day. We had over 100 participants, which included cancer patients, survivors, caregivers, all members of the clinical team, the nurses, the oncologists. We also had great and pharmacists. They played an incredibly important role that day. And also the executives that run the cancer centers, from the CEOs to the CFOs. And we got incredibly great feedback, just the energy and the inspiration that we all felt being on that Hill. And probably, of course, I'm going to love this as the advocacy director, but one of the most meaningful and consistent pieces of feedback that I received was that every meeting was great. Every member of each group, because we break out into groups by states to meet with the members of Congress or with their legislative staff, was that the most impactful and moving moments of those visits was when the patient was there or the caregiver was there to share their experience. And that's what CPAN is all about. So when we were on the Hill that day, as you can imagine, for all of you that follow the national oncology or policy news, there's constantly a lot of hot topics in the advocacy space. But what we chose to do that day, since we were such a large group and we had representatives from over 45 cancer centers across the United States, we decided to have a laser focus on PBMs and anything that interrupts the patient-physician relationship. And for those of you who continue to learn more about COA and CPAN and what we do, we don't like anything that gets in the way of an oncologist treating a patient. And unfortunately, that's what we're seeing more and more with PBMs. So we spoke a lot about how reform is needed with PBMs. And the good news is we had a pretty receptive audience. So again, this is a topic that has reached the halls of Congress, and we're happy to say that COA is a leader in this area. We did have a very specific ask, and that was to support the TACT Act, and that is the timely access to clinical treatment. And I want to tell you exactly what that is. Again, this is just a summarized version. The TACT Act requires that PBMs and insurers mandate that patients get their oral cancer drugs within 72 hours. And if they do not, patients are allowed to get their medication from any pharmacy or dispensing practice of their choice. And to read more details on who the sponsors are, please visit the COA website. Now I would like to introduce our very special guest, Diane Simard. She is the founder of the Center of Oncology Psychology Excellence. And I just love the acronym COPE. And she knows a lot about coping. Not only is she a very accomplished executive doing work in the aerospace and engineering sector, she is also a cancer survivor. And she has shared a lot of her knowledge through a book that she wrote, which is just one of her many accomplishments, where she talks about the gap that she saw as a cancer survivor in the mental health space. And like a lot of cancer survivors, she decided that she wanted to do advocacy work, and she decided to create this COPE program at the University of Denver. So Diane, I'm really excited to learn from you today, and mental health is definitely a topic that is important not only in the cancer world, but nationally. In fact, many of you may know that last month was National Cancer Month. And for those of you, again, who follow the national news, former First Lady Rosalind Carter has just been diagnosed with dementia. And I know, Diane, that you have a connection to that. And because of her work, former First Lady Rosalind Carter, a lot of attention is now being focused again on mental health, because she did a lot of advocacy around funding for mental health. So Diane, we're very happy to have you for this very timely topic. Welcome.
Thank you, Rose. It's so great to be here. And thank you all of you who are joining in today. I am going to talk today about the impact of psychological trauma on survivors' ability to heal. And that's near and dear to me for a multitude of reasons. But first and foremost, it's really what helped me, as I always say, kind of find my way back from cancer. So next slide, please. So my story begins near the end of my 16 chemo infusions. I was diagnosed with stage 3C breast cancer in 2015. And so I had a type of breast cancer that was behaving aggressively, even though it wasn't considered an aggressive type of cancer. And Rose, I'm guessing oftentimes that does happen.
Oh,
And
yes.
yeah, and so my medical oncologist uh, prescribed what I called the nuclear bomb treatment. And so I had 16 chemo infusions followed by lumpectomy and then radiation. And so it was near the end of those 16 chemo infusions that I started to cycle into depression. And I was worried that I would just never feel good again. And so I asked her for a referral to a therapist that understood, as I said, what it was like for a type A business executive like myself to go through what I was going through and needing to feel that I was in control and knowing that I wasn't in control. And again, that is such a frightening feeling. And so it was her response that really got me going on this topic. And she said, well, two things. She didn't know of any therapists that specialized in working with cancer patients. She goes, I know they exist. I just don't know of anyone that I could refer you to. And then she said, if you do find someone, they're likely not going to take health insurance. So you're probably not going to want to go. And I just went orbital. It was really the first time I just got angry throughout my cancer treatment experience and overall experience. I never really got angry, but I got angry about that. And so I ended up just, as I jokingly say, went Geraldo on this topic. And I discovered some dear friends at the University of Denver. And I ended up meeting the dean of their graduate school of professional psychology. And I'm headquartered here in the Denver area. And so that led to multiple conversations as I was going through surgery and then radiation. And within 2 months of me finishing my 10 months of treatment, we founded this Center for Oncology Psychology Excellence, or COPE. And I'm so proud the fact that to date, since COPE was launched in 2016, over 180 graduate level students have actually taken COPE classes. And so these are some of which are future licensed psychologists that now know how to work with cancer patients. And so this type of training had been available, but just not at the graduate level until COPE came to be. So it's one of the probably proudest things I've ever done, Rose. And I'm just so honored that you invited me here to speak about it today.
Diane, if I may just, one of the things that we talk a lot about with COA, and this is very, very interesting, is right now, again, in the national landscape, there's a huge issue with oncology workplace shortages. And a lot of that manifested during COVID. There was a need for more oncologists. We need more medical students. COA has a fellows program run by my colleague, Mary Krasunsky. But this is, to me, when I learned about COPE, having these graduate students who are focused, because there have been psychologists who have, quote, were willing to talk to a cancer patient, but the fact that you created a program to train for the specialty, I think that contributes positively to the oncology workplace shortages.
Yeah, thank you so much for mentioning that. It does. And one of the things that my heart is so warmed by is that students actually come across COPE as a specialty there at DU, and they just make a career choice on the spot based on this. It's a 4-course specialty. It's not a full degree program. We would love to see that happen someday. But there are multitudes of students who have come across and they said, I want to go enroll in this school, which is very difficult to get into, by the way, because I want to study about COPE. And I eventually now have decided that I want to have a career in this, working exclusively with those impacted by cancer. And I should mention, it's not always just the person going through the cancer. It impacts caregivers as well, and survivors, certainly, for years to come. So let's go on to the next slide, please. So all of this is what I call sort of the intersection of mental health and cancer. The term that I use is psycho-oncology, and it's a big word, but it basically means a specialty that addresses, and there's a variety of emotional, psychological, behavioral, and social issues that can accompany cancer. Cancer is such a complex experience, as we all know. And psycho-oncology, the efforts can include like taking care of the basic needs, improving patient care, provider communication, which I know is a big topic for COA. And then normalizing the emotional reactions. That sounds like a tall order, doesn't it? One of the things when I was going through this, the last thing I felt was normal. And so again, these are therapists now that have been trained to understand what it is that we go through, how traumatic this experience is, what it's like to face your mortality. And that's what's unique in particular about cancer. And there are some other diseases and health conditions that falls under as well. And so psycho-oncology has actually many names. Some refer to it as psychosocial oncology or psychiatric oncology, or simply supportive care services. And so it's one of those all-encompassing terms. And then the psycho-oncology providers, there's a whole gamut. They can include certainly social workers. And I know of a lot more students who are going into the social work field to specialize in just working exclusively with cancer patients. And one of the reasons, and in fact, one of my mentees just completed her graduate degree in social work because she wanted to get in front of clients as soon as possible. She had looked at a doctorate program and she just wanted, again, not to skimp or anything like that, but she just felt a need to be able to start working with clients as soon as possible. And so social workers are definitely getting into this field as well. There's behavioral health therapists and psychologists and certainly psychiatrists, and then nurses and nurse navigators, mental health counselors, and chaplains, and many others. And so this is a field that was certainly nothing new, and I'm going to get into the history here next, but it is growing and my heart is just warmed to see the attention that's being brought to this now. And again, Rose, this is really, I think, one of the reasons that you decided to talk about this topic today, because it is, mental health is just really on everybody's minds these days, isn't it?
And you have the word variety on there. And even just in our short time chatting, Diane, you mentioned how, you got really angry and went Geraldo. And I think that it's very authentic to say that, because a lot of times cancer survivors, everybody wants them to be happy and be positive and act like, you're going to get through this no matter what.
Right.
And the truth is sometimes you're really angry. And even on your starter slide, you talk about the emotional scars, but I don't know if anybody noticed, but the cancer patients who've lived through this have noticed you had a port. I also had a port. So you still live with the physical scars too.
Yeah.
And it is a variety, and everyone is always, I feel, pressuring patients to always act like everything's so positive. And sometimes, of course, you're happy. Of course, you want to get through it, but sometimes you get really angry.
Yeah.
And you shouldn't be looked at as a difficult patient if you're angry. You're just a person who's going through a variety of emotions.
Absolutely. And that's what psycho-oncology is about. And again, we're going to get into those specific emotions here in a little bit. So let's go on to the next slide. And I'm going to tell you a bit about really the history where psycho-oncology comes from. There was a phenomenal woman. Her name was Dr. Jimmy Holland. And she actually introduced psycho-oncology at Memorial Sloan Kettering Cancer Center in the late 1970s. And that's a picture of her here. And as you can see, she says there's no single right approach and no simple answer to dealing with the human side of cancer. And so she wrote a book, and it's called The Human Side of Cancer. And it was a very helpful book. It's not technical at all. And I highly recommend, if you would like to learn more about her approach to, as she says, dealing with the human side of cancer. She's considered certainly one of the pioneers of the psycho-oncology field. And she actually went on to become the founding president of the American Psychosocial Oncology Society, or APOS, which is a very, very important organization to which a lot of these psycho-oncologists belong to. And sadly, Dr. Holland passed away in 2017, just a few years ago, but this is kind of interesting. She's most remembered for pushing to recognize patient distress as the sixth vital sign in medicine. And of course, the other five are temperature, pulse, blood pressure, respiration, and pain.
Oh, wow.
And so this is considered the sixth vital sign, which is a really big deal.
Wow.
And then those of us who have been through this experience may remember the distress thermometer. I know I had, and it's where you self-report your level of anxiety and depression on a scale of 1 to 10. And I know I certainly had the nurse navigator when I was going through chemo come and ask me about, what is your level of stress, and on a scale of 1 to 10. And Dr. Holland was very, very much a contributor to developing that as well.
It's interesting.
Yeah. So next slide, please. So there's a lot to cover here, but it's been proven that psychological trauma can change an individual's capacity to reason, and sometimes even it's just savage. It erases your ability to cope. And so there's research data that supports this. In fact, in 2020, there was a global survey commissioned by the Wellcome Trust that found that 92% of people viewed mental health as being equally important to their overall well-being as their physical health, if not more so. And so this is not a surprise. Depression is particularly prevalent in people with cancer. That's also been proven. It's something that I certainly experienced. And so according to Dr. Holland, she introduced this idea that a cancer diagnosis often ignites memories of past traumatic events in your life, and that have been kept out of your conscience. And this happened to me actually during my cancer experience. And Rose, you read about this as well. I had the daddy-daughter phenomenon, if you will, happened to me when I was 6 years old. And so my father actually ended up being diagnosed with depression, but we believe now, and it was because of my writing my book, which is written in memoir style, that I discovered that he likely had late onset PTSD from the Korean War that came on about 15 years later. And so that all came to the surface when I was going through the toughest days of cancer treatment. And so it happened to me, and I was wondering, this happened, almost 50 years ago. Why is this so raw? It feels like it happened yesterday. And so that's certainly one area that's being researched. And then Mental Health America, their research has shown that there might be a connection between mental health and cancer survival. And so there is some early research that's happening that is indicating that paying attention to your mental health really truly does have an impact on the body's ability to heal. And as I always say, the brain is part of the body. And so it should not come as a surprise. And when you do focus on your mental health, research has shown that cancer patients are more likely to follow their treatment plans, participate in preventive screenings, and then even attend their appointments. And so again, I think it's interesting, Rose, because I think all of this comes together, and it's like society and ideally our healthcare system is recognizing that the state of our mental health really appears to have quite an impact on overall the outcome of this experience.
Diane, you mentioned your book, and of course I did read it, and how this triggered some memories, from your childhood and your family relationships. And I wonder, I guess the psychologists out there, and probably you obviously know this, but it makes me wonder if the correlation is how vulnerable you feel as a cancer patient, because that's something, again, I to this day am really pretty private about my own actual patient experiences. But what I will say, as a patient, I have felt and still continue to feel very vulnerable, whether you're, sitting there on the medical chair, just in a gown, basically, topless, and then, you're expecting one physician to come in, and in comes, 3 med students, and you're just constantly feel vulnerable and dependent. And especially for someone like yourself, you're an executive, you've done philanthropy, but all of a sudden you're just like helpless, and you're so dependent, on that provider right in front of you. So that must be what triggers those memories to come forward.
It absolutely is. And one of my words that I like to use is we're not mere medical commodities, right? We're human beings. And cancer is likely one certainly significant trauma that we're experiencing. But as I've mentioned, it's like everything in your life is now amplified. Past traumas, facing your mortality, your fear of everything, not knowing what's going to happen, not knowing, how difficult treatment's going to be. And then dealing with, other people's reaction. That was hard for me. All the staring, all the, I'm sorry. the dumb things that people said to me
Yeah.
that just didn't make me feel better. Again, certainly fascinating topics that we can talk about some other time. So let's move on to the next slide, please. And there's typically three very common mental health symptoms that result when you receive a cancer diagnosis, with those being distress, depression, and anxiety. And we're going to break those down one by one here real quickly. So next slide, please. And so distress is the first one. And much of my own distress actually happened within the first few days after my diagnosis. And I was overwhelmed because I'm such a doer and a go-getter. There was so much to learn. Like I actually Googled breast cancer, and the millions of responses came back, and I just didn't know anything about it. And I was just obsessed with getting good at cancer and trying to be a trooper when on the inside, like I am just imploding really and unraveling. And so I also felt this need to grieve, because I was sad that I was going to have to let go of my innocence and this idyllic, charmed life. And I think that comes from certainly my background in communications and public relations, about your image and how other people are reacting, and not even knowing how to even deal with what was really happening inside my mind and inside of me. So next slide, please. And then there's depression. And as I mentioned, my depression actually kicked in toward the end of chemo. And it's because of the cyclical nature of chemo. I just felt numb. And I just was afraid I was never going to feel good again. And so it was at this point when I started to question why the lack of mental health support as part of cancer treatment protocol. And I say this generally because again, this was 8 years ago, and I was treated at a local community hospital. And so it was just my experience, but I was just shocked, because really the only recommendation for me was to attend the breast cancer support group. And so I just felt like I needed to take my matters into my own hands, and I needed something to get me out of my cancer slump. So next slide, please. So anxiety, really, I was just anxious and nervous all the time. I just thought about cancer all the time. I couldn't stop thinking or talking about cancer. And I was always saying, let's stop talking about cancer. And of course, you never do. But I was obsessed with my concern about never feeling good again. And I don't know about you, Rose, but I just ached. I was nauseous. I just didn't feel good. I don't know how else to put it. And I couldn't sleep or eat my way out of this. And it was really, really hard. And all of that, all of these emotions kind of come together right into the perfect storm. And I was just thinking, when is this going to ever be over? And then add on top of that, the anxiety, the triggers, as I mentioned, my emotions were already high, and I was chemically launched into menopause during cancer treatment too. So that was, just another effect of all this. Next slide, please. And then Rose, I think you kind of touched on this, but fear of cancer recurrence. So for those of us who have been fortunate to have treatable cancers, and that have had the type of cancer for which there's tests, for me, the annual mammogram, and I just had mine last week and it turned out fine. Thank the Lord. But
good. Yeah, it's good news.
As many as 2 in 3 survivors have fear of cancer recurrence, according to very recent data. And so that's significant. The American Cancer Society puts a little bit higher than that at 70% have fear of recurrence. And so there actually is a fear of cancer recurrence inventory, and it's available online. It's a 42-item questionnaire, or there's a shorter version of that for anyone who's interested in and just seeing how severe this is. And there's also helpful tips on how to address this, because it's real. And it's in something that I coined: cancer's never invited and cancer never leaves. And what I mean by that
is true.
Is just these ongoing, like you've been through it once.
Yeah.
Certainly don't want to go through it again, but if you have a test, and it's important, I think, to consider that, but it just never goes away, right?
Diane, on that note too, like I say to myself, I'm very, very fortunate to now be a 20-year cancer survivor,
Yeah.
and I'm happy to be aging. I literally celebrate every birthday. But
Mhm.
as we get older, we go into the age group where cancer is the most prevalent.
Yeah.
So you're right, it never goes away. It's just part of who you are. It's part of our DNA now.
It is. It is. It certainly is. Next slide, please. So some mental health tips, and you can see these here. I wanted to just focus on one, and that's the scheduling these worry sessions, because I am a worry wart, high anxiety. I've always known this about myself, but there's one psychologist that actually encourages her clients to schedule 5 to 10-minute worry sessions and to just write down throughout the day as you have things to worry about or research or ask, just write that down, and then to sit with that for a brief amount of time and to say, this is my time. And if you come up with a plan to address those or whatever you do, but to have this specific time, and it's about processing and to acknowledge that these things go through your mind all day long and sometimes even when we sleep, and just to have this specific time to address it later with someone who can help you is I think really a great tip.
Diane, I
Yes.
wanted to share something also when you said write in a journal.
Uh-huh.
I want to give it, acknowledgement to a nurse that was very helpful to me, who said, because I didn't want to really share my true emotion. She said, write
Yeah.
it down. And I said, why would I want to write it down? What if
Yeah.
someone finds this paper? I don't want anybody to know what I really feel. And she said, Rose, write it down and then rip it up. And I thought that was just brilliant advice. So you might
Yes.
want to keep a journal, but also
Absolutely.
if you write it out, just rip it up. And I was like, that's really good advice. And I did that a few times.
Yeah, no, it's great. And I actually was
I regret
journaling.
ripping it up now, though, to tell you the truth.
And I was
but now I was like, oh, why did I rip it?
I was journaling very actively. I had no idea it was considered a therapy tool at the time, but going through treatment, especially chemo, was so hard for me. And then it was that the basis, my journal actually is what turned into my book. And because I'm a reporter and I report things, and it just ended up, who knew? And it was very, very helpful. So highly recommend that. So next slide, please. So as far as a call to action, highly encourage everyone to take a look at mental health as yet another facet of cancer. And as I mentioned, I'm so thrilled and pleased that more and more care centers are offering specific individualized support. Support groups are great, but people like me, I just don't do well in groups because I'm so busy analyzing everybody else that it's really hard for me to come back and focus on myself. So it's not really an effective tool for me. I mentioned APOS. They're a great society. They have great resources on their website, which is listed here. And also the National Institute of Health also has some great tips and resources caring for your mental health. And then if you are comfortable, and this is something I've done a lot more than I thought I would do, is to reach out and tell your story. And it doesn't have to be a Pulitzer Prize winning novel or anything like that, but just to get your story down and to share it with others if that's something that you're comfortable doing. And certainly Coping Magazine, which is a great, great magazine. Stand Up to Cancer is now welcoming those types of stories. And then Cure at the curetoday.com website are other resources. So next slide, please. As far as a final thought, and I just throw this out there, and I'm trying to be as protective as possible, but I do believe mental health support is going to continue to evolve. And my hope is that it eventually becomes a standard part of cancer care for any type of cancer. And the availability of these types of mental health services is it's growing. That's fantastic. It's kind of inconsistent. And then there's challenges still to all of this as to why it's not more prevalent. And those include long-term liability concerns for the care center, certainly insurance bureaucracy, and getting into the whole insurance aspect of this is a whole nother detailed conversation, and then budget limitations as well. But again, as research is continuing to show, I do believe it's so important for, again, those impacted by cancer, not just the person that's going through it themselves. There's trauma that's created for caregivers as well, certainly. And I sure hope that we continue to evolve and grow this and have this psycho-oncology topic become more and more prevalent in every conversation about cancer. So I'll leave you with this last slide. If you want to forward to the next slide, there's some that's a QR code to my website, some more information about me. I do have a monthly blog and newsletter that I produce, and I provide a lot of resources about mental health and cancer, if that's of interest to you, or send me an email. That's my email address there as well. And I'm also very active on LinkedIn. So just a quick overview of a very diverse topic, Rose, but I just am so appreciative that you invited me here today to give a few remarks about this very important topic.
Thank you, Diane. And well, Drew, we could go to the next slide. And also, I do want to, again, congratulate you on the success of being the founder of the Center of Oncology and Psychology Excellence. And also to say that I cannot speak for, every cancer institution across the United States, but many of our community oncology practices do have a oncology social worker on site, and or will refer out. And so that is something very positive coming out of the community oncology space. And again, when I say community, we mean the independent cancer centers owned by the physicians. But I think the combination of those services being currently provided and programs like COPE, hopefully we will reach your goal of increasing the focus and support for mental health. So thank you, everyone. Enjoy the rest of your day. Thank you, Diane. And don't miss our next advocacy chat on Wednesday, July 12th. Follow the COA website, follow us on LinkedIn to learn more about who our special guest will be. Thank you. Bye.